Do you frequently feel like your heart aches sometimes? Or maybe you've noticed your child has trouble growing at the same rate as other kids. What if facial features seem a little different, like eyes that are wider apart or a sunken chest? These signs might seem small, but sometimes they add up to something bigger. That's when doctors start thinking about conditions like Noonan syndrome. Think of it like a software glitch in your body's instruction manual. Everything is built from a set of genetic instructions, and when one letter is wrong, it can change how things grow and work. Noonan syndrome is one of those typos that affects how the body develops, especially the heart, face, and how tall someone grows. It's not contagious or caused by something a parent did. It's just a roll of the genetic dice. And the cool part, once we know it's there, we can help manage it. So what causes this typo in the body? Imagine your DNA as a big cookbook that tells your body how to grow. In Noonan syndrome, one of the recipe pages has a small spelling mistake. These spelling errors happen in specific genes like PTPN11, SOS1, ARAF1, or others. These genes usually help control growth and development. When they don't work right, the body's signals get a little mixed up. Most of the time, this mistake comes from a parent, like inheriting your dad's nose or your mom's smile. But this time, it's a gene glitch. But sometimes it's a brand new error. No one else in the family has it. It's like being born with a unique feature no one expected. The gene changes are passed down in what we call autosomal dominant way, meaning only one copy of the bad gene is enough to cause the condition. So if a parent has it, each child has a 50-50 chance of getting it, like flipping a coin. Now, what does Noonan syndrome look like in real life? Let's say you meet a child named Mia. She's bright and happy, but shorter than her classmates. Her parents notice she tires easily when running at recess. Her teacher says she needed extra help in early reading, not because she's not smart, but because she had some early learning delays. Her pediatrician sees that Mia has wide-set eyes, folds in the corners of her eyes, low, set ears, and a chest that curves inward. Later, a heart test shows a narrowed valve that's called pulmonary stenosis, a common heart issue in Noonan. Some kids might also have easy bruising, delayed puberty, or even small differences in their neck or hands. But here's the important thing: not everyone has every symptom. Some people have very mild signs, maybe just heart issues or short stature, while others have more obvious features. Each person's experience is like a unique puzzle. So how do doctors know it's Noonan syndrome? It starts with asking, what clues are we seeing? If a child has facial features, heart problems, or slow growth, the doctor might suspect it. They look closely at the face, listen to the heart, and check growth charts. Then comes genetic testing, a small blood test that reads the DNA cookbook to find the typo. It's like using spell check on the genes. Once confirmed, treatment isn't about curing the syndrome, but helping each part. For example, if the heart valve is narrow, a cardiologist might do a balloon procedure to open it, kind of like unclogging a pipe. Kids with learning issues get extra help at school. Growth hormone treatment might be an option if someone is very short. Regular checkups help catch issues early. Think of it like a car. Even if it was built a little differently, with good maintenance, it can still run great for a long time. Can we prevent Noonan syndrome? Right now, we can't stop the genetic typo from happening. It's like trying to prevent a lightning strike. It's random and happens before birth. But families with a history can talk to genetic counselors. Imagine a couple planning a family, and one parent has Noonan syndrome. A counselor can explain the 50% chance with each pregnancy, kind of like knowing the odds before a game. They might choose genetic testing during pregnancy, like amniocentesis, or use IVF with gene screening to reduce risk. But for most families, it happens by surprise. So prevention isn't about blame. It's about awareness, early diagnosis, and making sure support starts early. After all, knowledge is power. Now the exciting part: science is moving fast. Researchers are digging deep into how these faulty genes send wrong signals in cells. Think of cells as tiny factories, and the genes are managers. If the manager gives bad orders, the factory runs poorly. Scientists are now testing drugs that can retrain the manager medicines like MEK inhibitors, which are being studied in trials to help with heart and development issues. One day, instead of just treating symptoms, we might fix the signaling problem itself. There's also better genetic testing, faster, cheaper, and more detailed. Some kids now get a full gene scan in weeks, not years. And long-term studies are showing that with care, people with Noonan syndrome live full, happy lives. So while it's a lifelong condition, the future is brighter than ever, like upgrading